So it is very transmissible, but we do think that it's really these vulnerable populations that are at risk.
It's been about a year now that state and local health officials have been working to curb an outbreak of hepatitis A amongst the transient population.
And now the Colorado Department of Public Health and Environment says the first death has been blamed on the virus that attacks the liver. 9 News reporter Nelson Garcia joins us now. And Nelson, normally hepatitis A is not such a major problem.
Kim, Tom, to put it in perspective, so far just this year, Denver has reported 33 hepatitis A cases already this year. In the previous 5 years combined, there were only 21 cases. Unfortunately, the ones most likely at risk live in the homeless community. At the St. Francis Center in Denver, all sorts of folks are welcome.
So our community they're close together, they share cigarette butts, they share drinks.
Dr. Tammy Clark is the director of wellness here, and it was her job to make sure that hepatitis A was not welcome.
Coming from my medical background, I really wanted to put our best efforts forth to help our community members. A lot of them are already ill with chronic health issues. They're medically fragile.
So Clark instilled new policies.
We also increased our frequency of cleaning, like highly used objects that our guests and our staff use, like phones, the doorknobs, light switches,
and computers. Clark even added sinks to encourage people to wash their hands, a simple measure towards defeating the liver-attacking disease.
So basically, the hand washing helps because of the fecal-oral route, hands to mouth.
But this is just one place, according to the state's communicable disease epidemiologist, Dr. Rachel Herlihy.
So unfortunately, we've had a long-standing outbreak of hepatitis A here in Colorado.
The Colorado Department of Public Health and Environment says the state normally sees 20 hepatitis A cases a year.
So what we've seen so far since this outbreak started in the fall of 2018 is 163 cases.
It got so bad at the Denver jail this week, 3 housing units had to be shut down. Dr. Herlihy says the best defense is vaccine.
It is certainly a vaccine that we want to see people who are at risk during this outbreak receive. So that's, again, people who are experiencing homelessness, people with substance use issues, and people who've been incarcerated.
The St. Francis Center is holding another vaccine clinic Friday.
They've been very well attended.
Another effort to keep this unwanted guest away.
But our practices that was brought to our attention, cleaning practice and things, will stay on, which will help even once the hepatitis A outbreak has subsided.
So far, the state has issued more than 8,000 vaccines, and Dr. Herlihy believes these efforts are saving lives. The symptoms of hepatitis A to look for: severe abdominal pain, nausea, light-colored stool, dark urine, and a yellowing of the skin and eyes known as jaundice. Kim, Tom, just washing your hands can make all the difference.
It's always good advice, but you're definitely talking about underserved communities, and certainly the people who end up in jail, maybe a more manageable community than the homeless in some ways.
Well, certainly, one of the simple things is just to provide them access to clean up, which is one of the big issues, especially with the homeless population. Just give them a bar of soap and some water, and that can actually really prevent some disease.
Yeah, you hate to hear about these kinds of outbreaks. That's terrible. So, all right, thank you, Nelson.
You're welcome.